So, thank you to my fellow colleagues for their presentations. My name is Thomas. I want to introduce myself a little bit first because we don't know each other yet. So, I am from Oberwallis, and that's where I grew up and where I practice now. This is basically the view from my waiting room. Not exactly, but this is where I get to practice. So we live close by. Now, I went to study chiropractic in the United States as well. I was in New York Chiropractic College, and I graduated in 2005. And then came back to Switzerland and did my assistantship here, just like you are right now. And I graduated here with the exams in 2008, and then went on to open up my own clinic in Brieg, my hometown. And that's where I run my clinic. It's an interdisciplinary clinic now. I'm going to show you a little bit about that right now. But before I do that, I really want to tell you I'm very excited to be here now and stand in front of you guys, because this is great. You know, you are our future, our professional future, the future of our profession. And this is great that we get to talk to you, because really you are the next generation coming up that are going to take over from us one day also. And I can tell you, I am absolutely 100% convinced that chiropractic, our job, I think it's the greatest job that there really is. You know, there's nothing better than that, at least for me, and I hope it's going to be like that for you as well. Because it's a very, very fulfilling, enriching profession. It's great to work with the people, and you can be really grateful, and I congratulate you on the decision to become chiropractors and to actually follow it through. It needs a lot of determination, and of course it's very demanding, but you went a long way already, and you're going to get much better even and have a lot of fun with that beautiful profession. So I hope what I can tell you now is going to be some worthwhile information that you can take home with you into your daily practice, and that you can go on from there. Now I want to show you our clinic. This is where we work. We started in 2010, that's when we opened it up. We continually grew. It's an interdisciplinary clinic, as I said. This is the reception area right now, because we expanded always a little bit. Now this is just, we did this last year, it got a little bigger again. And we were able to expand. Now, this is our logo, the name of our clinic. And we have 4 disciplines that we offer for our patients. So it's chiropractic, of course, main thing. Then we have physiotherapy, osteopathy, and massage therapy. So we have those 4 disciplines combined in our clinic, which is a great thing. If you work interdisciplinary, you can talk with each other, you know, about patient cases. You can actually see what demands the patient, what's the need for the patient, and you can actually really adopt and adjust well to what they're doing, right, what they need. Now I'll show you my team. This is our current team right now. We have 2 chiropractors, 2 physios, an osteopath, and the massage therapist. And I show you this not to brag or anything. It's just, I think it's interesting to see how people work, what their clinics look like, right? What happened in my clinical evolution also really changed the way I practice, or my style of practicing, because I work together with these beautiful people. I was where you guys are right now about 15 years ago, I'd say. And since then, of course, there was a big evolution in technique-wise, of course, and then also what I got from knowledge that I learned on the way in the clinical experience. And also, you're going to develop and change. You're not going to be the same 5 years from now, and then again, not 10 years from now, because you're always changing with new demands from the patients, of course, that you see, new knowledge, new experience, and what you get to see in clinic. Now, this, of course, changes all the way you practice, or you treat patients, how you use your techniques. But then there's one point, I think, that is majorly important, what defines your technique in the end, and it's really your values. Each and every single one of you has a unique set of values. What is important to you in your life? You know, what gets you up in the morning? What is the most prioritized thing in your life, basically? And according to your values, you're also going to decide on what techniques you're going to use. You know, as an example, some people, they like to say, I want to see as many people as I can, so I'm going to choose a technique that's really going to help me do that. And there's other people that are going to say, I like to spend a lot of time with my patients, so that's a totally different value. You want to do that, so that's another technique there, right? Priska does nutrition, so AK for Roy for example. So this is also according to the values you have, right? And why do I tell you this? Because three of us tell you about our practical experiences, right? But the thing is, it's not up to us to tell you what the right way of practicing is. We can just show you our styles, and whatever you take from it, you take from it. If there's something worthwhile for you, take it. That's good, right? But it's not for us to say which is the best technique. There is no best technique because it's individual anyway. But we have, I would say, roughly about 50 to 60 years combined years of clinical experience. So there's at least something I think that we can offer you, especially I guess in the practical sessions in the afternoon. We did a lot of mistakes, we did successes, of course we had successes over the course of those years, and then we hope to share a little bit of that. So, each and every one of you, just like us, is going to have his or her own style of practicing. You know, if you take 10 chiropractors, or 7 for that matter, you're gonna get 10 different styles. It's always a unique style of practicing. And all we ask you to do is curiously listen today, what we have to offer, and then just take what you want and grow from it. So, take the piece of cake, enjoy it, digest it, and the rest you leave. All right? Now, I'm going to tell you about my technique, right? When I got into chiropractic, I was a kid of 12 years when I first got to the chiropractor. And right from the get-go, what really, really fascinated me was the fact that it's something actually very simple to do. And you only, if you really think about it, you only need 3 tools to do chiropractic. It's your 2 hands and your brain or your mind, right? As long as you have your 2 hands to work on the patient and your brain, your mind to decide what is needed and what has to be done, then you're good. Those are the 3 tools that you need. And I think it's important to know that because it's something so simple yet so beautiful and powerful that we have there. And as soon as you're a chiropractor, you are always a chiropractor. You're not going to change, you're not going to just switch off a light switch and then you're not going to be on the job anymore. Of course, you're going to take off your vacation and free time and everything, but you're still a chiropractor. If there's somebody that's in need for what you can offer, you've got to be there sometimes, right? So, for me, that's why I say the core of my technique is always the adjustment, chiropractic adjustment, but I do with my hands. I'm going to get to that afterwards. But just to illustrate that, I want to tell you a little bit of a tiny story there that I experienced once. We were on a vacation trip in France with my family, and we were at the breakfast table in the morning, and there I overheard the conversation of a young family from Germany at the neighboring table, and the kids were crying, and mom and dad, I saw that mom was in pain, and they were just discussing that they had to quit their vacation trip. And they actually just got there. They drove from Germany to France, southern France, and a lot of hours, and she apparently had some kind of an issue with her back, it looked like. So it didn't take me long to decide. I went over to the table, introduced myself, and told them what I am, that I am a chiropractor, and I offered my services to them because I thought, what can you do? At least offer it to them. And well, lo and behold, I was in the hotel room with her, and I adjusted her there. And a couple of hours later, long story short, is that she got better, and they could actually continue on their trip. So this is just to show you. I said it's a simple thing that we can do, but it has a major impact. You have to think about that and always keep that in mind and be grateful for what you got there. When we got back home from the vacation trip, we had a beautiful letter, and they were infinitely thankful because they actually could take their 3-week vacation there, and they had a lot of fun, so they could continue with what they did. All right. Now, talk to you a little bit about the adjustment. What I do, I use diversified adjustment. That's what I learned at the college in the US. And when I started off at the beginning, I did some adjunct therapies as well. I did ultrasound, E-stim, hot packs, and I put cold on or ice, and I even did some soft tissue massaging and stuff like that. That's what I did at the beginning. Now, I don't consider this really chiropractic anymore. And that's why I showed you the picture of my team before, because I told you this really defined my evolution also, because now I work together with physios and massage therapists, and this is something that I can delegate to them. So I can concentrate on my real thing, or my calling, what I need to do, and that's adjusting patient. And I can give this to my coworkers, to the people that work with me. So when I talk about my way of treating patients, still the adjustment there, and I always check the whole spine when I start with the patients. So I don't just chase the pain that they tell me, oh, I have a pain in my body or whatever, and I go adjust it there, because I really, my job is not to take the pain away at first. Of course, that's the important part for them as well, but my job is really to make their body function better, so in order that it can actually heal up and the pain goes away and actually stays away. That's the main goal. And also, of course, I want to keep them on the track to better health, because something happened that the problem actually started in the first place. There's incidents and accidents that happen like that, and there's a lot of people that are going to see that just not leading a very healthy lifestyle. And what you need to be doing, I think, is really helping them to get out of that and get into a better state of health, so that they can stay healthy and not have recurrent problems all the time. Right now, okay. What I use for adjusting, I have different techniques that I incorporate because it's diversified. Of course, we also use parts like Thompson drop technique or Cox flexion distraction. Now, just a quick question actually. Show of hands, how many of, or who of you actually studied in Zurich? So you graduated from Zurich. And the other ones, just show of hands, the other one? All right. Now, is this for, thank you, is this for all of you something that you know these techniques, or is that something, most of you know these different techniques? Okay, you see that. So Cox flexion distraction. I sometimes also do upper cervical toggle recoil, I learned that. Not very often, but I use it once in a while. Then I do cranial adjustment. I use that a lot on babies actually, or with TMJ problems, that's something that's very helpful. Activator instrument is something that I use. Also, it's not following a protocol, but I'm going to talk to you about that now. Then AK, I also have parts of it that I incorporated. And ART is something maybe you don't know. It's active release technique. It's a soft tissue technique. The thing is, I said before, I don't do soft tissue anymore, but this is a rather fast way of helping to release tension in muscles, and that helps me also to adjust sometimes better afterwards. So ART. And I use kinesiotape, by the way, also. That I think it's really helpful to help the people so they can hold their adjustments better. You can actually pick parts and pieces out of it that work for you, and that's what I did. A lot of people do that. You know, there's people that just do the activator, or just do Thompson drop, or flexion distraction, whatever be it, right? But I think as a diversified practitioner, it's nice to have the different approaches there and the different possibilities, because it gives you the opportunity to adapt better to the needs of each and every single patient that you see, because they're all different, right? You know, we say chiropractic is for everybody, and I think it's really true. Because, you know, in our clinic, we see patients from a very early age. So we see babies that are just a couple of days old, sometimes even just hours old. We see elderly people, of course, up to a very high age. And we see pregnant women, we see athletes, we see people from all walks of life, of course. And if you see all of that, of course you have to say there is not just one single treatment that fits everybody. It's individual. So you have to adapt and adjust to every single one and get the most. That's why what I found, at least for me, is very helpful if you have different tools that you can use in your technique. Now, of course, I think it might be a little bit overwhelming for you now as assistants if you see all the different techniques. Of course, you learned a lot, but I mean, there's so much more that you learned now, scientifically, clinically, and of course, you know, it takes you a lot of time to thoroughly do the workup with the patient, you know, then to decide on how to manage them and what you do, and then you get into technique, and then there's all that you have to worry about. So don't worry about that too much. I remember assistantship very well. You have to handle all that and take exams in the end, so there's just a lot of overwhelming time there. But practice makes perfect, and it just takes time. And in the practical session, we can probably show you some clinical pearls or some tips and tricks that you can use, but it's too big of a topic. That was also difficult for us to decide on what to present to you today, to actually go through technique like that. Of course, you had technique a lot, but what do you need, right? We're going to ask you that in the afternoon. So, I think what is important though, is that we have to take a step back. And if we talk about technique, it's also important to put ourselves in the position of the patient. Because ask yourself, what does the patient want from you, or what do they need from you? There's actually only two things that they really care about. First of all, they want you to listen to them, what you have to tell them, and what they have to tell you, and what their story is. And secondly, they want you to treat them and take care of them and help them. That's the important part. There's only those two things that they really want from you. They don't care about your technique. That's why I say that. They don't care about, I said it before also, they don't care what you learned or how much you did, how much evidence there is for what you do. That it doesn't really matter to the patient. It only matters if they get better in the end, And I think that's a very important concept to grasp, because you have to be aware that it's not about you, it's about them. So it's the patient that's in the middle of the whole thing, right? Then I come to, I think, the most important technique, which I would like to start every time with. And this is a principle that I heard many years ago, and it's called loving service is my first technique. So this sentence it was coined by Dr. Jim Parker. He's a founder of one big university in the United States. And I really think at first I looked at it and it really didn't tell me much, but if you really think about that, you have to say this is profound if you think that. You always start with this as the first technique, loving service, how you care about the people. That I think is the most the profoundest thing that you can do in your clinical practice. Because when a person walks into your office, you present themselves to you, you got to see them not as the hip problem or as the low back pain or as the migraine person. It's going to be a person that has a name and a story, and you want to see the person in front of you and take care of the person, not the problem. First of all, that's a very important thing to know. So it's not a difficult task. It's not a nuisance. You got to be grateful for every chance you have to change your life, because you're going to change lives and not just take away pain. And just to illustrate that, I think it's important to know if you have, for example, a grandma that, because you treated her, can again get to the floor and play with her grandchildren. You actually you had a major impact on her life, right? If you have an athlete that can perform much better in her next competition, you had a profound impact there as well. If you have a father that can get back to work and provide for his family after a long sick leave, then you have a major impact on their life as well. So, to really get to that point, I think you have to change your mindset a little bit and get into loving and caring the people. And this, I think, is an easy illustration to show that there's two actually types of relationships that you can have with the patient. It's going to be either this way, the very authoritarian type of style, where you, the doctor, is going to decide what they need and tell them everything that you know. And the patient is much smaller. Or there's the other way, where you team up with the patient and you actually are in the teamwork, because I honestly think that's what I tell my patients often. It's just a teamwork. We did this together. It's you, your body, and then what I can do. The rest, I cannot tell you if it's going to work or not. We never can, right? We try to do our best and to our best knowledge and experience, and then we go from there. So I think it's important that you team up with the patient in teamwork. Because then the iris is placed by we, and then illness becomes wellness. All right. Okay. To get there, as I said, you need a special mindset. How you show up to work, how you show up in practice. I think Roy actually touched on that before also. You have to be present with the patient. So when you get into the room with the patient, it's only what matters is the patient, the person in front of you. So don't think about the weekend in front of you. Don't think about what happened yesterday night with your boyfriend or girlfriend. Don't think about if the laundry is done or what you're gonna have for lunch or whatever, that does not matter at the moment. Be present at the time, on the moment with the patient there, and set your intention well. Have your goal set. What do you want to do with the patient? What goal do you want to achieve together with them, right? And if you really have that intent to do something, I'm convinced, and I know it from experience, your treatment and your adjustment is going to be so much more powerful and effective on the patient. You're going to get much better results from that. And as a byproduct, of course, you're going to have, first of all, success. You're going to be more successful, but you're going to have a higher energy level also. You're going to feel better, and your patient is going to feel better too, because you're happy. Now, and if that mindset, it changes like that, of course, the job is not going to be a job anymore. It's going to be more of a calling, really, that you're happy to get up in the morning and do that. And it brings me to the point that Roy also touched before on. It's the why, right? It's a purpose, why you get up in the morning. You have to have an impact. You have to define for yourself what you want to get to and what you want to reach. And that really has to be at the core of what you do. Now, just last weekend, I was in Utrecht at the ECU convention. This was the first presentation in the morning when we started. And this was a woman, her name is Rosanne Wormerdam, and she's a biomedical scientist. And she gave a presentation with the title, Live Healthy, Live Longer. And this really resonated with me very well, and also the way I practice, the way I use my techniques, because she said at the very beginning there, you can see about, she's talking about the health crisis that we are facing today. We know all this, or a lot of it, that we are having problems today in this society going on like the way we did it so far. But what really struck a note with me was that, even if these great numbers here, how maybe 50% of adults and 12% of our kids are overweight, or the average of your first chronic disease, the men are 40.7 years and women 37 something years, right? That's early on, and we're facing a lot of problems there. But what really resonated there was that she said the problem seems to be, what they found out now, the definition of health in our society today is a very minimalistic definition. And we define health just as the mere absence of sickness. So as long as you are not sick, then you're healthy. That's what society thinks health is. And well, she brought up a different concept then, which they're talking about now, and it's called positive health. I don't know if you heard about that before, but it's a new thing that they define it like that, and it's a concept where they talk about health assets that produce stronger health over and above the simple risk factors for disease. Wow, that was so interesting, because you see, this actually demonstrates about just because you're not sick doesn't mean you're well, right? So there's a whole spectrum of where you can be. You're either, if you're neutral, doesn't mean that you're in good health. It just means that you don't feel bad, probably. But that's just a step away from poor health, or even feeling bad or sick, right? And then in the end, die. But I think the very important part of this is that it's a biomedical scientist that tells us chiropractors that. And this is at the core of our genes, basically, what we do as chiropractors. This is what I told you before. It is so important that we teach the patients what good health is and where they stand, or where they could stand, where they should get. And I think it should be a huge role that we play in this whole concept that we can take that over. That's why she came to talk to us at the ECU convention, because they think now also we are facing a health crisis that is going to be very detrimental if we don't do something about that, and there needs to be somebody that takes the lead and helps the people to get better. And chiropractors, I think, should be at the forefront to do that. Now, so we're not just painkillers, as I said before, but we really have to help the people get to better health and stronger health. And she showed I just want to show you this other slide that she had up, because she was talking about the different aspects of health there. And she put them up as batteries, you see. So she has physical health, mental health, emotional health, and she put purpose up there as well. Very interesting. I just talked about purpose before to you guys, right? How it's going to change your direction, your technique, and how you practice. And it's interesting because she said they are aware of it now that the healthiest people on the world, they found that they have, almost all of them have a bigger goal, have some purpose in life, that they're clearly defining it. And if you think about that, it really makes a lot of sense, because that's something that gets you up in the morning, gets you up from bed, and then the first thing you think about is, oh cool, today I can go into my practice again, see people change their lives and help them, right? That's what we do. Now, I think it really helps if you think about that a little more thoroughly, because you have to define it for yourself. You even write it down sometimes, and then if it changes, you write it down again. For me, we have a professional purpose or goal that we define in the clinic and also personally. And I have to tell you, the statement for us is really to help as many people as we can with our services, to get our society to better health. And one thing that I think for me is also a very important part of my goal is that what we do right now, what we build up, and it continues to grow, and that it actually continues to exist after we are done. Because, you know, I can do this hopefully for many more years, but then one day it's just gonna be done, right? And then it would be so sad if my kids and the kids of my patients and the next generations, they wouldn't have the ability to profit from what we have to offer. And that's when we need you guys. So this is like a commercial, because this is really what we need. We have, I'm so happy today when I see all of you, because, you know, we're what, 35, 34 people, you know, that are assistants right now. That's great, but we need a lot more from you guys. And we don't need them just at the, in the city areas like Zurich or Bern or Geneva or somewhere like that, but we need you also in the periphery. That's where I showed you where I work, you know. We have a ton of work. We have a lot of people that need our services. And as I said, it's a commercial. I invite you to come by and also check us out. Come to our clinic sometime and see how we work and get to know the people. If you can even think, you know, a little bit about maybe going to practice in the Alps sometime and enjoy beautiful weather all year round, come by and you know, just give me a shout and we'll see us in Brig. Okay. You can't change the world. You can change a person's world. The more people you help, the more worlds you've changed. Wow. So, I hope that you continue to learn and to grow and to change lives, to change society, as I said, because, you know, I congratulated you at the beginning for what you decided to become. I congratulate you again, because you will see many, many patients, many people, and you will get the chance to change a lot of lives and a lot of worlds like that, right? And I am convinced, I'm sure that you're going to shape the way this goes on in the future. You're the future for us. You're going to shape the future of healthcare, and you're going to hopefully be part of the solution for the healthcare crisis that we have. Be grateful for your gift that you have and enjoy every step of it. It's a beautiful, beautiful job, as I said. You can enjoy a lot of it and have a very good time with your patients. Have fun, do what you like and like what you do. Thank you very much.